That's me, and that's my partner Jenny. My son.
Eleanor Drazier knows everything about the threat of measles. She's a doctor and a mother, and her son caught the potentially fatal disease when he was just 10 months old.
After 5 days of fever, he had a rash and he was really, really unwell. And he was then unwell for another 10 days before he was well enough to go back to nursery.
Dr. Drazier blames deliberate misinformation spread on social media.
I blame people that are peddling misinformation to those parents. I don't believe that anyone who doesn't vaccinate their child is doing it to be willfully difficult. I believe that parents are fearful that something is going to happen to their child because they've given them a vaccination.
Dr. Drazier's son is now a fit and healthy 12-year-old. But measles has re-emerged as a danger, and the number of childhood vaccinations being administered is falling. In 2018-19, there was a drop in the uptake of all 13 routine childhood vaccinations in England, including diphtheria, tetanus, polio and meningitis. In 2017-18, just over 91% of children had the first dose of the MMR vaccine. A year later, that had dropped to just over 90%. For the second MMR dose, 87.2% of children were vaccinated by their 5th birthday in 2017-18. A year later, that figure was 86.4%.
Right then, young man.
The UK lost its measles-free status in August. Widely discredited anti-vaccination propaganda is partly to blame.
Ooh, don't look.
But parent complacency, access to health services and itinerant populations are also factors.
I think we can get to the 95% target. We know what we need to do. We need to ensure that parents have ready access to vaccination. They often need reminding to go, particularly for the later vaccines.
In August, Boris Johnson called on parents to ignore superstitious mumbo-jumbo spread on social media. He also said he was considering mandatory vaccinations, something Health Secretary Matt Hancock repeated today. Almost eradicated, but now on the increase, these childhood diseases can be prevented from spreading if parents choose to inoculate. Ashish Joshi, Sky News.